What is lupus?
Lupus is an autoimmune disease where your body's immune system attacks healthy cells in your body. So for example, when you have an allergies attack, your body's immune system would normally attack the foreign cells that are entering your body. But when you have lupus, your body's immune system is confused into thinking your healthy cells are foreign and they attack them, which can cause inflammation in your body.
So what causes lupus?
They are under-researched. Lupus is under-researched, so they don't actually know what causes lupus. It is more present in African American and Hispanic and Indian women, so more women of color, and it's stronger in women, but men do get lupus as well. And they are trying to find, if there's a hereditary factor or natural causes of lupus, but right now it's still unknown, and they just know that it is a chronic disease.
What are the symptoms associated with lupus?
The symptoms present themselves as inflammation in your body, ranging from your joints are swollen or achy, your skin gets rashes, which is why they say the lupus rash is the butterfly rash, where you get this part of your face looks like a butterfly. You can also get rashes all over your body. You can get sores, ulcers, your kidneys start going bad. You can have multiple symptoms that look like other diseases, so that's why it's so hard to diagnose lupus patients.
Speaking of diagnosis, how were you diagnosed?
I was diagnosed after 2 to 3 years of going back and forth with doctors and hospital visits, and it was really because my uncle has lupus, and he suggested that I ask the doctor to test me specifically for lupus, which you do need a specific test. They usually ask to see your ANA results from blood tests, and that's how I was officially diagnosed.
So how do you manage your lupus?
For myself, I manage my lupus with just the experience that I've learned throughout my 14-year journey with lupus. So I take medication. I recognize when I need to take a break, and stress factors, which is a big cause of lupus flare-ups, or lupus flare-ups are when your symptoms start presenting themselves. I take daily, right now, I take prednisone, which is a steroid. I take Plaquenil, which is an anti-malaria drug, actually. And I take weekly injections of Benlysta, which is for the lupus symptoms like my achy joints. And I take a blood pressure medication. I take an antidepressant medication. And I also take, I use an inhaler as needed for the asthma symptoms that I experience. I have previously managed my symptoms with chemotherapy, a chemotherapy drug also called Cellcept, and just range from aspirin to any other over-the-counter pain medication.
So what do you wish you knew on your journey to a proper diagnosis?
I wish I knew that one doctor's say-so isn't the final word, that I am able to go and get second opinions, that the one doctor that may not know lupus won't say it. So you do need to speak up for yourself, ask questions, and if you don't feel like this is right, like there's something further, you are able to push it. You can always go to a different doctor for a second opinion.
And what advice would you give someone who is recently diagnosed with lupus?
The best advice I could give someone is knowledge. You need to first, for yourself, learn about lupus, learn about symptoms, because when you start feeling a certain type of way, you should be able to recognize this is a symptom of lupus, what caused it, and how you could avoid it in the future. Like if something's causing you stress, you're stressed about school or work or family, and you notice the next day or even the next week you start feeling bad, you can learn ways to avoid that stress or to de-stress yourself. I would advise you to educate your family and friends about lupus so they can help you recognize those factors as well, and to ask questions when you're at the doctor's. I am going to be putting on my website a downloadable link for questions that you can take to the doctor's appointments, especially if you're newly diagnosed.